Ruth, Vivian and Amelia have been making music together as a trio once every few weeks for the past 3 years. They have learnt to listen to one another and to communicate non-verbally through their music making. Although their main point of contact is through their playing, at times the musical exchanges can be intense and moving. They continue to learn to pick up and trust each other's musical ideas. In many ways, the musical exchange that Aidan and Amelia have together during their music therapy session is very similar. Amelia and Aidan have been seeing each other for weekly half-hour sessions for 7 months. Like the chamber music players, they have learnt to trust each other's music. Of course, in chamber music, the musicians play from a score, and in the music therapy session, Aidan and Amelia are improvising together. But the non-verbal communication is similar, and in both cases the exchanges are often exciting and intense. Unlike the musicians, however, Aidan, who is 5, has a diagnosis of childhood autism. As a result, he has severe communication difficulties and often appears to be in a world of his own. At times he will flap his hands in a repetitive way, and his play will lack apparent form or direction. To help him to focus, Amelia spends part of their music therapy sessions playfully running around the room with him. Later in the session, he can concentrate more easily, and Amelia tries to give the playing a basic shape through stopping and starting. Here, the cello and the clarinet take turns to play little scale passages which answer each other. At first, the scales are calm and there are small gaps in the playing. Then, as the tension builds up, there are no more gaps. The phrases become shorter. And eventually, the cello and the clarinet seem to be interrupting one another. The fact that music happens in time and that harmonic structure can give phrases predictable and expected endings allows the music therapist to give a basic shape to fragments of time which have previously had no form or meaning. Aidan is clearly reassured by the predictable nature of the music therapy sessions. He has learnt to predict beginnings and clearly recognises this song. At the end of the guitar playing, he requests that the instrument should be put away, using language and understanding structure.
guitar? Shall we put back the guitar?
Unlike Aidan, Jack does not have a diagnosis of childhood autism. He is diagnosed as PDD-NOS, which means pervasive developmental disorder of a non-specific type. Jo Holmes, child and family psychiatrist, explains.
Pervasive developmental disorder is an umbrella category which covers such diagnoses as autism and Asperger's syndrome. It also includes PDD-NOS, that is, pervasive developmental disorder not otherwise specified. This is the category which covers children who have autistic symptoms but don't have enough symptoms to meet criteria for autism or Asperger's syndrome. Aidan, who we saw previously, has got autism. Children with autism have impaired or abnormal development that is present before the age of 3. They have difficulty in 3 areas. Firstly, they have difficulties in reciprocal social interactions, for example in making eye contact or using gesture. Then they have difficulties with their communication. They can have delayed or absent speech or use words in an unusual way. And thirdly, they have restricted, stereotyped or repetitive behaviours. For Aidan, as for many children with autism, music therapy can provide a non-verbal form of communication where some of the usual demands of speech-based communication can be bypassed.
I'm going to go to sleep. Oh, you woke me up. Oh, Aidan's going to go to sleep. Wake up. Oh, you woke up. Aidan, wake up. Oh, you want me to go back to sleep?
Jack has a diagnosis of pervasive developmental disorder of an unspecified type, that is PDD-NOS. As you can see, he initially appears not to want to engage with Amelia. However, his response at the end of the singing shows that he was listening and attending to her.
Shall we put the guitar back? Finish with the guitar? Yes, okay. Put the guitar back.
Later, as in Aidan's session, the music making process allows Jack to communicate with Amelia more directly. Here, Jack becomes very involved and excited. He shows creativity and imagination by initiating a game of peekaboo with the camera that is filming him.
Is he hiding behind the chair? Oh no, he's there. He's come back now. He's over here. Is he hiding? Is he going to dip on the ground? We can just take our time.
Matthew, who is 3, also has a diagnosis of childhood autism. From the beginning, he made it clear that he wanted to share his sessions with his mother.
Bang! Bang!
In the sessions, he flits from one thing to another, but occasionally the music therapist is able to engage him in brief, playful musical exchanges. Later in the session, she tries to echo his movements and noise exchanges with his mother. She reinforces the strong and healthy bond between mother and child. During the session, Matthew often chooses to withdraw from the adults by going behind a screen at one end of the room. However, he continues to communicate through vocal sounds and particularly responds to Amelia's clarinet playing. Towards the end of the session, he is able to have a brief exchange with Amelia on the piano. Matthew has made great progress since he and his mother started weekly individual music therapy sessions 6 months previously. His mother is convinced that the sessions have enabled Matthew to use sounds and later words to communicate.
Yeah, because at first he wasn't using any speech, just sounds. Whereas since he's come to music therapy, he's definitely started talking and vocalising a lot more. So it's brought me to tears a couple of times seeing the way Matthew's been. When we first came, especially, he really, you know, he'd done some things then that he's never done before, which was really good.
Oh. 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 Oh.
Young babies communicate with their mothers through non-verbal sound exchanges, which can be very similar to the interactions in music therapy sessions. Here, Claire has a conversation with her 7-month-old son, Jamie. Because they are not motivated to communicate, many children like Aidan, Jack and Matthew will have never experienced these babbling exchanges as babies. The music therapist can recreate these types of dialogues through improvised sound exchanges, which can, as in Matthew's case, then lead to the development of speech. Another reason why music therapy is an effective means of communication is that sound exchanges and turn-taking can be playful and fun. The musicians here also take turns, and there is a humorous side to Brahms's music in this passage. just as these musicians have to work together as a team, professionally qualified music therapists cannot treat clients in isolation. Amelia discusses her work with parents after every session and liaises with other professionals, such as speech therapists and teachers, to discuss the progress the children are making and to agree on treatment objectives. In addition, Amelia has fortnightly supervision with an experienced clinician to discuss any aspects of the work she is worried about.
I think over the years I've specialised in working with children with communication disorders, whereas lots of different children will benefit from music therapy. Children with communication disorders or children on the autistic spectrum often seem to only be able to communicate through music.